Hospital, and Mr. Ashish just gave you an overview of the hospital which has been set up here. And with us today, I have the privilege of having Dr. Rana Sandeep Singh. He's an ex-PGI, a very dear friend, a very accomplished cardiac surgeon, both in neonates, pediatric cardiac surgery and adult cardiac surgery, and ex-professor in PGI Chandigarh. We have Dr. Mahesh Garg, we have Dr. Sanjeev Rawat, we have Dr. Priyanka Bansal, and a number of new experienced cardiologists will be joining this center very soon. So as you know, worldwide cardiac diseases are increasing. And when we talk about increasing cardiac disease, this is a double-edged situation because as the cardiac disease keep on increasing, we keep on chasing them and getting treatment options for all these diseases. We have succeeded to a very large extent worldwide, but unfortunately, India, in some certain segments, we still have not been able to transform that progress which we have made in international cardiac care to patients who are actually needy. And therefore, we have almost 6 million patients of heart disease in India, which is only the tip of the iceberg. Patients which we know. So there are a lot of patients which we do not know, are a lot of persons who are likely to get cardiac disease. So when we talk about so much burden of cardiac disease, worldwide, if you go to US, you talk to somebody, an Indian, you meet an Indian, you talk to him, he would be a doctor. And you talk to doctors in US, you will find he's an Indian. So worldwide, that's the same situation in Europe also, that Indians are doing extremely well in medical care. Unfortunately, in India, we do not have that amount of penetration in interiors of India and rural areas and outreach areas of India where international cardiac care is not available. At the same time, India being a diverse country, if we look at the metropolitans in India, you look at Mumbai, Delhi, Chennai, Chandigarh, Mumbai and other places, you'll find that the treatment option is comparable to the best in the world. I'll give you an example. If heart attack, the amount of time which we need to treat heart attack patients in West is no better than what we do in India. So therefore, we have best doctors, we have best cardiac facilities in India in certain segments, but there are a lot of areas which are still uncovered. And therefore, there is a need to have state-of-art, large, quality heart care centers in India more than ever before what we realized. So therefore, in the light of that, you would see Palace Hospital coming up in this region and adding to the already very good cardiac care which is available in Tri-City. I believe cardiac care in Chandigarh is next to none in India or anywhere in the world. But Palace Hospital will add on to that with a better equipment, with a better manpower, and the better hospital facilities. When we talk of cardiac care, what we look at? We look at triage emergency, where we manage patients, receive patients of acute cardiac syndrome and acute heart failure and other cardiac emergencies. We talk of coronary care units, where we manage these patients who are critically sick and often have multiple other diseases as well. We talk of cath lab, which should be state-of-art, where we can take care of all patients where interventions are required. And we talk of surgical setup, where surgery for neonates, adults, and elderly patients can be carried comparable to the best in the world. And if we look at all these four facets, we look at the facilities of emergency, coronary care unit, surgical ICU, operation theaters, we have the best in the country and probably comparable to best in the world. We talk about manpower, and you will realize that the manpower manning these areas of cardiac care in Palace Hospital is the best in the country. And I'm very fortunate to inform you that the staff which we have got here today, and I'll show you some of those members who have joined our cardiac center, are the best in the Tri-City. So we come here with a completely equipped cardiac center to take care of all sorts of medical emergencies, medical stable coronary disease, stable patients also who require cardiac care. At the same time, when we talk about cardiac care, we believe, and that is the motto of Paras Hospital also, that considering the number of patients which are there in our country, care is not going to be enough. We have to look at prevention of these diseases. And when we talk of prevention, we talk of catching patients at a very early stage, guiding normal people that they should have a healthy lifestyle so that the chances of them getting heart disease are much decreased. And in case they have risk factors, how do we manage that? And therefore, we believe in Paras Hospital that awareness about heart disease, awareness about risk factors, and awareness about healthy lifestyle is the way to go forward. For that, we intend to organize public awareness programs, walkathons, lectures, CMEs, conventions, conferences, workshops to tell patients and prospective patients and normal healthy people that healthy lifestyle is the way to go forward. So the focus is going to be on preventive health care. But along with that, those patients who have been suffering from heart disease would be taken care of. And when I talk about coronary interventions and other types of heart disease, I want to tell you that we have the expertise today to treat all sorts of cardiac patients in adults, neonates, right from neonates to elderly patients. And I'll give you some example of what our team has been able to achieve. We talk of complex coronary intervention. You would remember about 20 years ago, we used to say whenever we talk about coronary angioplasty, we would talk of taking care of single vessel disease or double vessel disease or multiple lesions or something. But today, expertise is available where almost all types of coronary lesions can be taken care of. And I'd like to pause here for some time for you to digest that this includes multiple vessel disease, three vessel disease, left main disease, bifurcation diseases, heavily calcified lesions, osteal lesions, small vessel disease, and you name it, and that can be tackled by angioplasty. That expertise is available, that hardware is available. The special type of guide wires we need, the special type of balloons we need, the rotablator we need, or other type of devices we need are available. So all types of coronary artery disease can be tackled by an angioplasty stenting. We believe that this is a coronary care or this is a heart team which will go forward. And therefore, to have Dr. Rana Sandeep Singh here in the team makes the team that much more better, because we believe that each patient is an individual who has individual requirement that can depend on his background, that can depend on his disease profile, that can depend on his other features, the socioeconomic features, and therefore the cardiac team, heart team, should be taking a decision on that, what is the best treatment option for them, for him. Is it angioplasty, is it bypass, or is it a hybrid technique? So therefore, we believe that all sets of coronary artery lesions, all sets of patients can be taken care of. And we also know that now patients are becoming more complex. We are living longer. If life expectancy some time ago was about 60 years, 65 years, today it is about 80 years. And therefore we're seeing a lot of patients who are in their 80s and 90s. And these patients, many of them, have got heart disease, and we have expertise to tackle those heart disease. So let's see complex coronary intervention. I have had the experience of performing many complex coronary procedures, and I have shared with you some of those over the last 20 years. And these procedures have been recognized internationally, have been presented in intervention conferences worldwide, and have got us laurels, not only for me, but for this Tri-City also. So therefore, complex coronary lesion remains a very important focus of our team at Paras Hospital. Now, this is one of the cases which I did recently, which got international acclaim. Now, this is a post-bypass patient in which no option was available, and we were able to do this procedure, which is called the retrograde ultimatum. We had to use complex procedure to do this thing, and I have shared this thing. We have also performed many novel procedures in world. Some of these techniques have been recognized internationally, and one of these techniques which I recently innovated and presented at international conferences was a new technique to do ostial corneal lesions. When I was talking about complex corneal lesion, I did mention about ostial corneal lesion. Ostial is the beginning of the coronary artery, and that is angioplasty of standing of that area presents specific problems. And we were able to devise a new technique to have precise ostial coronary artery stenting and with long-term result, and that was also presented in international conferences. Now, as I said, in 80s and 90s, we are seeing patients of heart disease. We have a large experience of doing angioplasty in octogenarians and nonagenarians. This our elderly Auntie Ji, I would say grand Auntie Ji, she was 102 years of age, and she had 5 generations. And she presented to us with coronary artery disease. We did an angioplasty stenting, and I have shared her story with you because she is grandmother of one of our colleagues among journalistic community. Also, she made a good recovery. So she epitomizes that we can take care of very elderly patients also. Some of you and your colleagues and your friends would have grandparents who are suffering from heart disease. Previously, we used to believe that they cannot be tackled by either an angioplasty or doing a bypass. But today we have the expertise to do both, and Dr. Rana would be telling or doing bypass surgery in these elderly individuals also. But she is the oldest patient in India to undergo a coronary angioplasty stenting. So in octogenarian, there are specific problems. They have multiple other diseases. They have lung disease, they have liver disease, they have vascular diseases, peripheral vascular disease, they have hematological abnormalities. Some of them have low hemoglobin, low platelets. Many of them have got renal failure. So all of these complexity add to the complexity of tackling these patients, and we are able to take care of those patients. So we have a large experience of doing angioplasty stenting in these elderly patients' complex coronary disease. Now we are also seeing that heart failure is increasing worldwide. That's increasing because we are aging population, and we are saving patients who are living longer. High blood pressure, diabetes, coronary artery disease, valvular disease, when these people survive for a longer period of time, they go on to develop heart failure. And previously we used to believe that heart failure is a death sentence, that 50% of patients who have heart failure would be dead in 2 years' time. But today, with advances in medical treatment, we are able to help them. And it has become a specific area of expertise for Paras Hospital. And we treat these patients by medicine and with devices. We have specific type of pacemaker, which are ICDs, CRTDs, combo devices, by which we help them. We also have expertise to do what we call as an artificial heart, a left ventricle assist device, which is done with the expertise and experience available from cardiac surgeons to help these patients who have end-stage heart disease. Previously, we used to believe that LVAD, left ventricle assist device, is a device for patients who are going to get a transplant. But we believe that now left ventricle assist device can also be a destination therapy. By that we mean that it can be final treatment option for many patients with heart disease. Some of these patients need a short-term stabilization so that their own heart recovers. And we have a device which we call as the ECMO. So ECMO takes care of cardiac and respiratory component of the patient's body for a period of time, about 2 to 3 weeks, so that the body's heart function and respiratory function improve, and therefore we take care of that. So we believe that heart failure is another area in which expertise in Paras Hospital is comparable to what is available in the West. We're going to have a heart failure registry, a heart failure clinic for these patients who have got heart failure and who require long-term treatment. So this is how a left ventricle assist device looks like. We have a device which bypasses the left ventricle and takes care of the needs of the body by pumping blood directly into the aorta. And this is a destination therapy also. So in case a person's heart or lungs, heart is not taken care of and he has reached end stage and he's not a candidate for transplant, we can put in a left ventricle assist device. A small procedure takes about 2 hours and the patient lives a long-term life. And we have patients who are surviving for almost 12 hours worldwide. We also have newer devices which are becoming available worldwide by which we can have cardiovascular support during the interventional procedure. Till recently, we only had intra-aortic balloon pump to help us. But now we have a new device by the name of Impella. By Impella, we can reduce the risk of complex, high-risk procedures during the time of coronary intervention. And we can have a biventricle assist device also, that both the right ventricle and left ventricle are artificial and they take care of body. And in the periphery, we have expertise to tackle all types of blockage, be in the aorta, be in the subclavian artery, be in the carotid artery, be it in the abdominal aorta or in the legs or below knee also. So all types of blocks can be taken care of, and we also have expertise to tackle aortic aneurysms, be it dissection of aorta or thoracic aortic aneurysms or abdominal aortic aneurysms or infrarenal aortic aneurysm. We have had a lot of experience to tackling these. This is one of the patients which was again presented at an international conference, a large aneurysm, the largest which has been reported in world literature of the hepatic artery, the artery which supplies blood to the liver. Now that was repaired by an endovascular technique using stent grafts. First time it was done in worldwide. We also have expertise to take care of all types of blockage of the arteries supplying blood to the brain. Carotid artery stenting is very easy, and I have the largest experience of doing carotid artery stenting in the country. We've done more than 150 carotid artery stenting, but intracranial angioplasty and stenting, arteries which are present inside the cranium, be it the cranial artery, be it the branches of the carotid artery, or be it the vertebral artery going into the cranium. We have the expertise to do angioplasty stenting. This is another experience of doing an angioplasty stenting of intracranial part of the vertebral artery, presented at international conference, got us acclaim for Tri-City. Now this is rare and one of the most complex procedure. Now when the heart ruptures, it is usually fatal. And unless surgery can be done within hours, within an hour or so. But this patient presented to with heart surgery. I was in PGA at that time. It was 2006, and we repaired it with non-surgically by putting in a device. And I'm very happy to tell you that this young man is alive today, and he's surviving, and he's doing a normal, healthy life. There are new techniques becoming available. And two of them are replacing or treating valves non-surgically. One is the transcutaneous aortic valve replacement. And about a couple of months ago, I shared with you that we did a transcutaneous aortic valve replacement in Tri-City for the first time, and the patient is doing very well. So today in degenerated aortic valve, in elderly patients where surgery is not possible, or surgery is very high risk, we have the capability and expertise of treating these aortic valves non-surgically by putting an aortic valve through the groins. Patients make recovery in a day and is up and about next day. We are also acquiring expertise to treat the mitral valve by mitraclip technique. We should be getting it in a short while. It's just becoming available in India. So a lot of these new techniques are becoming available. This is how the aortic valve looks like. When it gets degenerated and calcified, it doesn't open well, so it causes blockage to the left ventricle output. So that produces symptoms of angina, heart failure, and very, very early death. So to treat that, many of these are not amenable to surgical valve replacement. We can treat them by a TAVR, what we call as a transcutaneous aortic valve replacement. This picture depicts how do we go from the groin and we replace the aortic valve non-surgically. No cut, no sutures, only non-surgically, and we close the groin wound non-surgically by using knots. So we believe that all this is possible because of close collaboration between surgeons, anesthetists, and cardiologists. Therefore, the motto is going to be in Paras Hospital, heart care team or heart team. Each patient requiring treatment, where is going to be evaluated by this heart team, and what we are going to offer what we believe is the best treatment of option for that particular patient. So all this is going to be possible in Paras Hospital, and I have a lot of expectations, hope from this team. This is our team which we have got accumulated over the last few months for at Paras Hospital. A number of other experienced interventional cardiologists or surgeons are going to join this team, and I believe, and I have no doubt, that this should become the center of excellence and the center which will give the best options for patients, not only in Tri-City, but in the 5 cities surrounding here: Haryana, Punjab, Rajasthan, UP, J&K, Himachal. All these patients from these states would benefit by the expertise which is available there. Now I request Dr. Rana Sandeep Singh to give you an overview of what surgically is possible in Paras Hospital. Dr. Rana Sandeep Singh, please.